Imagine this. A new mom, Sarah, just 3 weeks postpartum, she starts to feel short of breath. She notices that her legs are unusually swollen. She dismisses it, thinking it's part of the recovery process. But over the next day, her symptoms worsen, and she just can't shake the feeling that something is wrong. She's in a little bit of denial. She's thinking, okay, I'm mom, I'm doing a lot around the house, I'm just overexerting myself. Let me just rest. But she just knows that I just don't feel myself. So she tells her partner. Her partner insists that she needs to go to the emergency room. So they call their OBGYN. The OBGYN sends them to the emergency room where I see them as an emergency room physician. Turns out Sarah has a serious blood clot, a condition that could have worsened, a condition that could have taken her life if left untreated. Stories like Sarah remind us why it is essential to recognize postpartum danger signs and act quickly. Welcome to another episode of Fourth Trimester Voices, where we provide critical education, resources, and stories to help you, mom, thrive in your postpartum journey. Today's episode is all about postpartum danger signs and the top causes of maternal mortality. This episode is a life-saving conversation, and I really encourage you to share it with every mom, share it with every partner, share it with the grandparents, share it with anybody in your circle, because everyone should be looking out for this and making sure that you are staying healthy and whole. So let's just first talk about why this episode is important. Did you know that in the United States that we have one of the highest maternal mortality rates among developing countries? According to the CDC, about 700 women die from pregnancy-related complications every year in the United States of America. And 23% of those deaths happen between day 7 and 1 year postpartum. Think about that. Nearly 1 in 4 maternal deaths happen well after mom has left the hospital and has started adjusting to life with her baby. And let's just also talk about the disparities, which are alarming. Black women are nearly 3 times more likely to die from pregnancy-related causes than white women. These outcomes just are not due to medical conditions, but they're tied to systemic inequities that exist in this country, inequities that exist with healthcare access as well as treatment. But here's the key. Up to 60% of maternal deaths are preventable with timely care and awareness of danger signs. I'm going to repeat that. Up to 60% of maternal deaths are preventable. This is why we are diving into this episode today, to empower you with the knowledge to recognize when something isn't right and advocate for yourself and also your loved ones. So today we're going to talk about the top 5 causes of maternal mortality in the United States of America. And I'm hoping that when you finish listening to this episode, that you know the signs and symptoms that go with these conditions. So let's start with the leading cause of maternal deaths in the United States of America, and that is cardiovascular conditions. Pregnancy and childbirth puts a huge strain on the heart, and for some moms, this can lead to dangerous complications like something called postpartum cardiomyopathy or peripartum cardiomyopathy. So basically, the heart muscle weakens, and women get shortness of breath, especially when laying down, swelling in the legs, or feet that doesn't go away, a rapid or increasing heartbeat, extreme chest pain, or extreme fatigue. Other cardiovascular conditions that exist are heart attacks, right? We talk about there's hormonal factors that are involved in this. There is just the strain that goes into the heart when a woman is pregnant or postpartum. And then there's just worsening of pre-existing heart conditions. So if a woman has high cholesterol, high blood pressure, diabetes, they're a smoker, they have pre-existing heart risk factors, they're going to be more likely to suffer the consequences of cardiovascular causes of death in the prenatal and postpartum period. So I just want to pause a little bit and repeat some of these symptoms that you could experience when the heart is involved. Difficulty breathing. When you lie down, you feel like something is waking you up in the middle of the night because you can't breathe. Chest pain, particularly chest pain when you're walking. Every time you walk, your chest is hurting. Every time you walk, your heart is racing. These are signs that are very serious, and you need to go into the emergency department to get evaluated immediately. So let's move away from cardiovascular causes and talk about something that maybe many of you, if this is your second baby, you've heard a lot about this in your discharge summaries. They talk about this, but it's infection, right? Infection is a second leading cause of maternal mortality in the United States, and this can happen for a slew of reasons. It can happen from an infection in the C-section incision site. It can happen from infection within the uterus. It can even happen with a urinary tract infection. People don't know that an untreated urinary tract infection can seed bacteria into your blood, can take over your body, and can cause serious problems that can lead to death. If left untreated, these infections can lead to something called sepsis, which is a life-threatening condition, or even death. Here are some warning signs that you need to know of an infection. Fever. So you're having a fever over 100.4. You're smelling something funny, whether that's your urine or you're having foul-smelling vaginal discharge. You're having significant pain or redness around your C-section incision site. You're seeing that maybe part of your incision has opened up a little bit and it's draining some thick white discharge. It hurts when you touch it. You're having pain in your lower abdomen. Now, this one is a really difficult one to kind of assess because if you've had a C-section, generally you're going to have some discomfort, especially around the wound. But the pain that we really get concerned about is pain that's worsening from post-surgery. Or if you've had a vaginal delivery and you did not have any abdominal pain, now all of a sudden you're having significant pain. Pain plus fever is even more alarming and should make you want to call your OBGYN to ask what are the next steps to do. Postpartum infections can escalate really quickly. So I know you want to wait it out, wait a couple days, see if things are going to feel better, wait it out, see if the fever comes down. The minute you start to feel bad, you're having chills, you're having fevers, you're having worsening abdominal pain, you need to notify somebody because this can get bad pretty quickly and can seed into your bloodstream and lead to severe complications. The next thing I want to talk about is postpartum hemorrhage. So severe bleeding after childbirth. Most cases are going to happen within 24 hours of delivery. So you're going to be in the hospital. That's why they're coming to check on you. They're pushing on your belly, making sure that you're not going to have bleeding. However, for a lot of patients, you can have delayed postpartum hemorrhage, and this is scary. I did have one of my clients who bled about 3 weeks postpartum. She was doing fine, no issues, and all of a sudden, she just started bleeding heavily. Thank God she had the sense to go straight to the emergency department because she was educated that this is something that is not normal. Okay. Now, signs that you may be hemorrhaging include soaking through more than one pad per hour. Obviously, if you're having a gush of blood and you're unable to even replace the pads, that's a problem. Go straight to the emergency department. You can call your doctor on the way. That is an issue. If you're passing clots larger than a golf ball, that's an issue. If you're feeling dizzy, lightheaded, or faint, this can be signs of anemia that you're losing too much blood. And also, when your heart rate goes up, this also can be signs that you're losing too much blood. Watch out for your skin. Some people may have had bleeding while they're in the hospital or bleeding shortly afterwards, and they're just kind of oozing slowly, but they're losing so much blood volume that they can have signs of anemia, such as pale skin, pale conjunctiva. And so these are signs that you really want to be mindful of because if you need blood back, you're going to need to go to the emergency department because if you are losing blood volume, your heart is not able to pump perfectly. Your brain needs blood, rich oxygen. oxygen rich blood to be able to do the metabolic functions that it is used to doing, right? So your blood carries oxygen to parts of your body, and if you're losing blood flow, you're not going to think straight, you're going to feel lightheaded, you're going to feel dizzy, your heart rate is going to go up because your heart is not working with very much, right? And so this is actually a true emergency. I don't even think you have time to call your OBGYN first with this one. If you start hemorrhaging, I need you to call 911, get an ambulance there right away. If you're within 5 minutes of the hospital and you feel like your husband or spouse can drive you, get in the car and go straight. I just advise you that heavy bleeding is not something to play with, and you just need to get to an emergency department quickly. The fourth thing I want to talk about, which we have talked about extensively, is postpartum preeclampsia. If you want to hear more, one of my moms and friends and colleagues, she did an episode on her story and her journey with postpartum preeclampsia. And as an OB, she shares and breaks down just everything that was going on and what was happening at that time and what symptoms she experienced. But postpartum preeclampsia is a critical condition, and this one can be a little bit tricky because a lot of people know that preeclampsia exists during pregnancy, but not a lot of moms understand that you can get this condition up to 6 weeks after you deliver. This condition is when the blood pressure goes up and can lead to serious complications like seizures, organ damage, so issues with your liver, issues with your kidneys. And so this is not something to play with. Some symptoms moms can have with this include severe headaches that don't go away with Tylenol, vision changes like blurry vision or seeing spots, swelling, particularly in the face, the hands, and the feet, and high blood pressure. I do want to tell you, moms, that I've had a lot of moms who have had postpartum preeclampsia or elevated blood pressure in the postpartum period, and they did not have any symptoms, right? They didn't have any of these symptoms. For one mom, I was just checking on her incision, and I always check women's blood pressures afterwards and checked her blood pressures. Her blood pressures were elevated, sent her into the emergency department. Bam, postpartum preeclampsia. I had one mom who just felt funny, like something is not right, elevated blood pressure. So, for a lot of moms, especially busy moms who are just trying to get through the day to day, they may not be noticing these signs and symptoms, or they just may not have them. So, I do encourage every mom to have a blood pressure cuff in their home. And if their blood pressures are elevated, 150 over 90, you really need to call your OBGYN to basically speak with them about your blood pressure readings. And they send you home and they tell you this in your discharge summary, but I'm here to emphasize it and to say why exactly it is important. Postpartum preeclampsia can lead to seizures, organ damage. It is a serious thing not to be played with, right? If you're experiencing any of these symptoms, contact your provider immediately and get to the emergency department. This is no joke. All right. Usually with postpartum preeclampsia, you can have some conversations with your OBGYN and they can advise you to go to labor and delivery or the ER, depending on what hospital system you're in. So do call your OBGYN for this because you will need to be admitted to an OBGYN floor if you do need treatment for postpartum preeclampsia. And then the last condition that I want you all to be aware of the warning signs are mental health conditions. We also talk about this extensively in other episodes, but it's very overlooked. So I don't mind repeating this over and over and over and over and over again because it's a really critical aspect of postpartum care. And it's something that I emphasize with my patients when I see them. I'm constantly screening for mental health conditions. Believe it or not, postpartum depression, anxiety, psychosis is very common, and these can have devastating effects if left untreated. Warning signs: sadness, hopelessness, feeling worthless, difficulty bonding with your baby, thoughts of harming yourself or your baby, hallucinations, or paranoia. If you or someone you know is struggling with these feelings, please seek out help. You are not alone. There's no shame in asking for support, for therapy, medications, and support groups that can make a huge difference. The last condition that I'm going to talk about is blood clots. This one, as an emergency room physician, I see this all the time. I shared with the story upon the opening, blood clots. So what are the symptoms of blood clots? Swelling in the legs. One leg is bigger than the other leg. You can even have blood clots in both legs. And so you're having significant swelling that's worse from your delivery. Pain in the legs, right? Difficulty breathing, chest discomfort, lightheadedness, dizziness. These are also signs of having a blood clots. Blood clots have devastating consequences if left untreated. And so this is definitely something you want to be aware of. You can see that blood clots does present similarly to some of the cardiovascular conditions. And so in your mind, you should just be thinking, if I'm short of breath, if I'm having swelling in my legs that's worsening from when I was delivering, if I'm having leg pain, chest pain, lightheadedness, dizziness, these are all signs that I need to seek medical attention. Okay. So definitely memorize or just kind of go over these things when you are preparing yourself for the postpartum period and just take a body scan. I wrote a book called What to Expect Next. And in the book, I literally ask women these questions. And I want you to take time to go through your body and figure out what is different, what is not normal. Because oftentimes when you're in the postpartum period, you're too busy. You're doing things with your baby, you're barely sleeping. And so you're not taking the time to just pause and scan your body and say, what am I feeling? Is this normal? Do I need to let somebody know about this? And if you're not sure, tell your husband, tell your spouse, tell somebody about it, tell your doctor about it, and let them see if they can make that decision for you, particularly your healthcare provider. They'll probably want to see you. They'll talk through some of this and see if it's normal or not. Your partner can just maybe assure you or encourage you to see somebody or talk to somebody about it, because sometimes we put doubt in ourselves, and we can talk ourselves out of a doctor's appointment. We can talk ourselves out of going to the emergency department. So I really don't want this for you, moms. Now, we've talked about the signs and symptoms of things to look out for with these conditions. And I want to tell you, as I said in the beginning, 60% of these deaths are preventable, which means that most of these things that I talked about can be treated. So let's just go through them, right? Cardiovascular conditions. If you present to the emergency department quickly, if you're having signs of a heart attack, they can manage that quickly to try to get your heart working better. Now, the postpartum cardiomyopathy, that one is a tough one. In most cases, the heart improves, but in a lot of women, they still end up having residual signs of cardiomyopathy or a weak heart muscle. Some moms have made a full recovery. Unfortunately, I have met moms who have severe heart failure that occurred during pregnancy or in the postpartum period. And that is always devastating to see, particularly a mom who is young and now is living with such a chronic, life-altering condition. So, with conditions like this, get to the hospital quickly. If you do have pre-existing conditions, before you get pregnant, you want to make sure that those things are managed before you enter pregnancy. If I have a mom who is listener here who is listening and hasn't yet made the decision to get pregnant, this is definitely something you want to consider. If you have a pre-existing condition, try to get it under control before you get pregnant, because it can lead to devastating complications. All right. Infection. Infection, easy. Get to the hospital on time. There are antibiotics, there's IV fluids. They can get you treated. They could figure out where the infection is coming from and do something about it. So this is something you do not want to play with. Postpartum hemorrhage. You get to the hospital quickly. There have done so many things. There's so much research, so much work out there in improving standard of care when it comes to treating postpartum hemorrhage. So this is one of those things that it's like you got to get to the hospital quickly, right? Because if you're losing blood volume, you need volume back. So you're going to need either the fluid or you're going to need blood. And then they have to do everything they can to stop the bleeding. They're going to give you medications. If they can't do it that way, they may put in something to stop the bleeding or tampen out the bleeding in the uterus. And worst case scenarios, you may have to go back for surgery. And so this is something that can be treated if you get to the hospital in time. And then postpartum preeclampsia, if you need to be admitted, they're going to try to get your blood pressure down. They're going to give you a medication called magnesium. And so one thing that moms sometimes get caught up on with this diagnosis is that once they get diagnosed, they have to go back into the hospital and they have to be on a drip called magnesium. And they feel like they're strapped to the bed, they can't move, they have a Foley catheter. And some women feel violated or feel like their rights have been taken away. And I'm just going to say this, right? You did the hard part. You had your baby and you had a healthy baby. Now it's time to take care of you. And if you have to be still in that bed for them to get you back to normal, you just have to do it, mom. It is the protocol, is the standard of care. They're going to have to give you that medication, and they are going to have their own policies of how they have to take care of you while you're getting that medication. So try not to worry too much about that. In most hospitals, you're going to be able to bring your baby to the hospital, breastfeed your baby, bond with your baby. So definitely get to the hospital if your blood pressures are elevated. Don't think about, I need to leave my baby, or I don't want this treatment, I don't want to be admitted. This is your life. Your baby needs you to be around. So just consider that when you have to go into the hospital. Sometimes we have to do things so we can stay alive, okay? We want to be around and alive so that we can be here for our children. Okay. And then mental health disorders, there's medications that we can give you. There's therapy, there's groups, there's just so much treatment when it comes to mental health conditions in pregnancy. So definitely please seek out that guidance. I just want to say this. Please trust your instincts. If something feels off, don't wait. It's always better to err on the side of caution. Call your doctor, visit urgent care, go to the ER, show up in the waiting room of your OBGYN's office, right? If no one is listening, make some noise, tell somebody, tell your doula, tell your husband, call me, right? If you're experiencing symptoms that are concerning to you, don't let anybody tell you it's in your head, that you're making stuff up, right? Tell someone. This is your life. Your health matters, mom. You've been through one of the most physically and emotional demanding experiences of your life. Recognizing these danger signs and seeking help could save your life. You are strong. You have power. You deserve compassion. You deserve the best care every step of the way. So use your voice. Please. If you found this episode helpful, I urge you to please share it with another mom. Listen to it with your partner. Listen to it with your birth worker. Knowledge is power. Together, we can change these statistics, right? We obviously know there's so many things that are involved in why women are dying in this country, but there's certain things that we need to take control of. We need to take a body scan. We need to raise our voice. We need to trust our instincts. Knowledge is power. Knowledge is power. Okay? And what I'm going to do with you is I'm going to attach a free guide that's going to be postpartum danger signs checklist. If you need personalized support, please visit my website so that you can be able to learn about my services. I am licensed to work in the state of Georgia. I work around a 30-mile radius around the Atlanta area. I take pride in what I do. I want my moms to feel supported, advocated for. I go through this checklist with all my moms because I want to make sure that we're keeping you safe. I work with your OBGYN or your midwife to make sure that we are giving you well-rounded, holistic care. If you need anything, email me at fourthtrimestervoices@gmail.com. Until next time, take care of yourself. You deserve it. If you live in the Atlanta, Georgia area, I want you to consider working with EM Care to You. And this is my concierge medical company, and we offer comprehensive care for mothers postpartum. I started the company because I saw a need. I was taking care of so many postpartum moms that had a need, and I wanted to provide a solution for their problem. So at EM Care to You, we provide access to in-home lactation support, pelvic floor physical therapy, mental health support, and more. You can learn more about this at emcaretouYou.com. Thank you for joining us on this episode of Fourth Trimester Voices. If you have any questions about today's episode or you want to share your story, please email us at fourthtrimestervoices@gmail.com. My name is Dr. Choa, and it's been lovely talking with you all today. Take care.